So now that we've talked about homeowners insurance, we talked about car insurance, we're going to spend some time talking about health insurance. Okay? Now, health insurance is a hot topic. Okay? Not just for us when it comes to the class, okay? But also because it's a debated topic right now when it comes to both the government involvement in health insurance and, of course, how much health insurance costs themselves have risen, right? Okay? So we're going to talk about the different types of private health care plans that are available. Okay? We're going to talk about the use of government health care plans, both outside of the United States and inside the United States. Okay? And then we're going to talk extensively about the involvement of the government in the new current plan, okay? And how it's going to impact either the private sector or what happens, overall. We're talking about long-term care insurance. This is as you get older, who's going to take care of you if you have chronic illnesses, okay? And we're going to talk about the benefits, a little bit about disability insurance, not a lot. Again, mostly we're talking about health insurance. So health insurance itself, the type of health insurance that we're going to talk about mostly is private. That's bulk of what we have in the United States, okay? So it's offered by private insurance companies or the government that covers your health care expenses incurred by the policyholder, that would be you, okay, for necessary medical care. Now, the first part that we have to talk about is that word necessary, and this comes up a lot when in this health care debate, okay, because what is necessary and what is not? And different healthcare providers have different views on what's necessary. For example, a lot of healthcare providers say that reconstructive surgery of any kind is not necessary, which means like no plastic surgery. What happens if you're in a horrible accident, and let's say you break your nose, and your nose is all smashed in, and you need some reconstructive surgery to rebuild the cartilage in your nose? Well, some insurance companies will just say, no, forget it. We're not going to pay for it because that's reconstructive surgery. Okay, and some people argue, well, wait a minute, you're not putting me back whole. You're not putting me back in one piece if you don't complete that. So that term necessary is going to become vital to some of our arguments later on. Critical component of financial planning, absolutely, because this can be really expensive. And just to give you an idea of what I talk about when I say really expensive, some healthcare insurance plans are $10 to $15 per paycheck. That's not a big deal. That's okay. That's reasonable. Okay? But when I say it can become a critical component of financial planning, some healthcare plans are $200, $300, even $400 per paycheck. That's $400, $600, or $1,200 per month. That's a big number. If you have a $1,000 a month healthcare plan, that means it's $12,000 a year just to have healthcare, and that's just your premium. We know in insurance, you know what's coming next. We have things like deductibles, and in healthcare, we have things called copays, and we'll get into those. Okay? So it definitely has to be involved when we're talking about financial planning. The cost of providing healthcare is rising. It's just a fact. Now, here's the annoying part of that. The bulk of the rise in healthcare comes from the fact that the doctors need more insurance because there's more lawsuits. Not much of it comes from direct costs of the doctors getting paid more, the hospitals getting paid more. A little bit comes because the equipment we use nowadays is a little more expensive because it's more technologically advanced. Okay, you know, an X-ray machine doesn't cost as much as, say, an MRI machine. An MRI machine is very expensive, a couple $100,000 piece of equipment. Okay, so the equipment's got a little more expensive, but what's really been driving this healthcare rise, this cost rise, has been these lawyers who want to sue every doctor because they did something wrong. Okay, so we see the cost of what we normally refer to as malpractice insurance. Okay, that's been really on the rise. About 1 in 5 workers are uninsured. 1 in 5 people. We have 15 people in this class. That means 3 of you will be uninsured when you're working. That's pretty alarming. Your health care insurance decision is not whether to obtain it or which plan to purchase. I want you to know you need health insurance. It is expensive to not have it. I'll give you an example. I know somebody who, again, we'll pick on the gentleman for a moment. He was a gentleman, doesn't have that good impulse control, was angry, walked outside of a court building after the judge had told him that he's going to have to pay $275 in fines for a ticket. Okay? He walks outside and he's mad. He punches a wall. Now let me just know a little tidbit about medical history here. Your body cannot withstand a beating against concrete. Okay? The concrete will win. Okay? So he turns around and punches a concrete wall. He fractures his hand, goes to the hospital, has surgery, gets 2 titanium pins in placed, doesn't have medical insurance, gets the bill from the hospital, $17,000. So let's get this straight. He punched a wall because the judge made him pay $275 in fines, and now he's got a $17,000 medical bill because he hit a piece of concrete. Okay, so we need to be smart about these bills. We need to have health insurance. It just needs to be part of your repertoire, okay, in your financial lives. There are many options available, especially in the United States. We have private, we have some government funded, we have some government kind of supplemented, and now even more so we have some more government plans or some government intervention. And that, of course, is the great debate. You in this class are one of the major projects are going to write your own health care plan for the United States of America. You're going to give me your plan. After we've gone through this, we'll have an arsenal of information, whether you choose to use a government-based, a non-government-based, however you want to mix it up, but you are going to write your own health care plan. Okay? So private health care insurance. This is the bulk of what we have in the United States. It's health care insurance that can be purchased from private insurance companies. Okay? And all it does is provide coverage, again, insurance we've talked about, for your health care costs. Okay? Things like going to the doctor, having your tonsils taken out. Okay? Going to an allergist. Okay? Up to major things like surgeries, cancer treatments. Okay? This stuff gets expensive. And we need to have a way of covering it. So here are a few types of private healthcare insurance. Hospitalization insurance. This is a basic insurance. And the hospitalization insurance just says if you need to be hospitalized for something, that's normally something they call acute, which is something that's severe and happens, very quickly. So you break your leg, you're in a car accident, okay? Your kidney explodes, okay? You have a hernia, okay? For those of us who like to lift, okay? So insurance that covers the cost of most hospitals. Now this is basic insurance. So if you just have hospitalization insurance, you're only covered if you go to the hospital. And the hospital is the most expensive place to go. Okay, so we have to look at this as just a basic type insurance. A lot of employers give this to part-time employees who have been there longer than maybe 6 months or a year. But that's it, just hospitalization insurance. Okay. We have surgical expense insurance. Again, another portion. Just covers surgeries. Now, surgery is an expensive thing because not only does the hospital charge you for using their facilities and equipment, but many times the surgeon gives you a separate bill. So you get a bill from the hospital, you get a bill from the surgeon, you get a bill from the anesthesiologist, and all these different people are billing you something different. Okay?
When I went to the emergency room a couple years ago, they even were charging us for doctors that weren't even doing anything.
Yeah, and
they were literally, they came in and asked me if I was in any pain, and they were like, I was like, no, and then we literally noticed that their names came up and we were charged like $1,500 for them.
Yeah, you get this, what they call padding your chart. And that's a doctor walks in and says, how are you feeling today? You're like, I feel great. I feel fine. No, I don't need any aspirin. I'm doing okay. They're like, okay, great. They put their name down. They sign it. What happens is the hospital can now charge you for what they call a doctor's visit at a rather alarming rate, right? Okay. Physician expense coverage. Insurance that covers the cost of many non-surgical physician expense fees. This covers, for example, what we just talked about, where these physicians are visiting, okay, and they're padding your chart, but they're not really helping you, okay? And it can also cover things like seeing a standard physician for, more mundane things like a cough or cold, okay? Now, major medical. Here's where, again, the bulk of the United States sits. They have major medical, okay? Major medical insurance is used as a backup to basic health care insurance, covers major medical expenses that are beyond the scope of your basic policy, okay? Now, we've all seen these commercials, Aflac, right? Aflac is something that goes beyond major medical, okay? Because remember the Aflac duck gets in the argument with that little, I don't know, what is it, some little bird. And he's like, major medical boy! And then it's like, Aflac, right? They're like arguing. Major medical covers things that are beyond the basic scope of your basic policy. And then we have things like Aflac that are above and beyond. Okay? So options. We're going to have a lot of options. Okay? Many employers offer health insurance as part of the benefit package. Being a teacher, for example, we get medical insurance through a plan. Okay? Okay? And the cost is usually shared. The employer pays some, the employee pays some. Okay? And self-employed individuals, they wind up paying the entire thing. Whether they have their company pay for part of it directly or they pay for it, if they own the company or they're self-employed, it's still coming out of their pocket, one way or another. Okay? So these are kind of our options. We either have the employers who are going to supplement or pay some of it with you, or you're going to have that self-employment, which is going to be where you're basically paying the entire thing, whether you write it off as part of the company expense or you pay for it out of your own pocket.